Hey folks, it's Beth Wright, and I am providing you a podcast for in UR 236, Unit 1, and this is involving drug therapy for men's health, Chapter 45. So we're looking at, these are your exemplars, and we're looking at the androgen drug classifications, basically the testosterones, the phosphodiesterase type 5 inhibitor classifications. And if you notice all of those, sildenafil, tadalafil, vardenafil, notice all of those have that fil at the end of them, FIL, so that's a good way to try to remember that. And we'll talk a minute about those specific types of meds. We have the 5-alpha reductase inhibitors, finasteride and dutasteride, and these notice also have the ride at the end of them. And then we have our alpha 1 adrenergic blockers, tamsulosin. Okay, so let's talk a second about your androgens. So we're talking mainly about your male sex hormones here that are synthesized from the cholesterol, and it's testosterone is normally the only important androgen, and it does have increased production of testosterone that can result in changes with puberty in the adolescent male. And it functions to include development of their male sexual characteristics and reproduction and metabolism. Secretion begins around age 11 to 13. And then you can also see in the book, in your textbook, box 45.1, that the effects of testosterone work on the skin regarding thickness of skin and, of course, sebaceous glands, which are part of why individuals develop acne at that puberty age. We have the voice that occurs, you start seeing the male as they grow into their puberty, adolescent age. Their voice starts getting deeper, and they have an increase in hair production, like beard, and in the beard, and the mustache, under arm, in the axillary area, and in the pubic area. We have that skeletal muscle growth that begins, and both bone growth and sperm development that occurs. So issues related to androgens can be quite embarrassing, especially for children or adolescents, but we have the primary hypogonadism and the secondary hypogonadism. And let's talk a second about that. So an androgen deficiency can be from a problem with the hypothalamus. It can be from the anterior pituitary or from the gonads. And primary hypogonadism is related to a testicular disorder or trauma of that area. And secondary problems are from the hypothalamus and the pituitary regarding the production of testosterone. This can be caused by tumors in that area or any other kind of chronic disease that causes issues here. And so signs and symptoms would be erectile dysfunction, infertility, decreased beard and body growth, decrease in muscle mass, gynecomastia, which is where males develop breast, And they can also have a loss of bone mass as well. And they can experience fatigue, hot flashes, a decreased libido, and a difficulty in concentrating. So lab work that's going to be done here is checking the hormone levels of testosterone as well as FSH and LH hormones. Other issues related to androgen is the erectile dysfunction, and it's also the initials of ED you'll see a lot of time. And of course, this is where a male will have trouble initiating or maintaining a penile erection. And it can be caused from lots of different things. Medications, for one, such as antidepressants, antihypertensives, histamine receptor antagonists. It can be caused by lifestyle issues such as alcohol use, tobacco, illicit drugs such as cocaine, or it can be caused from diseases such as diabetes, thyroid, prostate cancer, cardiovascular disease, and obesity. And also psychological disorders as well can cause that. So this is where a person's going to have a low testosterone, and of course that's going to decrease a sex drive. And our signs and symptoms here have to be obtained by a history given by the patient. Now, benign prostatic hypertrophy is another issue related to androgens, and that's also known, you may see that as benign prostatic hyperplasia as well, but basically it's an enlargement of that prostate gland. And the prostate gland, there's two lobes located in front of the rectum and below the bladder, and when it becomes enlarged, this causes issues with elimination. So signs and symptoms here are going to be a decreased outflow of urine. There may be a frequency, hesitancy, urgency type of symptoms that the patient will describe. Also dribbling, a decreased force of urine stream. They may complain of nocturia, post-voiding leakage, and they can also have issues with urinary stones, and infections can occur as a result of all this. So these are some of the issues related to that. Now, I have you a pictogram regarding the prostate problems, and this is a cute one as far as, well, probably males don't think it's cute at all, especially ones who are experiencing this problem. But prostate problems are no fun. Frequency, urgency, nocturia are your common signs and symptoms there. They may also have blood in the urine. They're definitely an increased risk of infection because that urine is stasis. It's staying in there. And so we know anytime something is stasis, that's not a good thing. The decreased urinary stream and an increase in residual urine, which is again urine that's staying in there and not coming out as it's intended to. So got a little question for you. Erectile dysfunction is difficulty initiating or maintaining a penile erection. Is that true or false? And the answer is true. That's exactly what it is, and it can cause issues with satisfaction of sexual relations for an individual. And as we will recall, you know, sexuality is a part of our holistic nursing, and it's, you know, we have to consider that and talk with our patients about that when they're having issues. So here are our drug therapies. We've got the androgens and the anabolic steroids. Now, the anabolic steroids are not listed as one of your exemplars, but nevertheless, it's something that we do need to talk about and be aware of. So we'll talk a minute about that. and then the phosphodiesterase type 5 inhibitors, your 5-alpha reductase inhibitors, and your alpha-1 adrenergic receptors. So for our androgens, testosterone is the prototype androgen, and of course the indications for use are going to be some kind of deficiency. Now you never want to take a medication if you don't need it, and especially a hormone, because you know they can cause so many different problems. Okay, so we have some different types available of the testosterone, and the testosterone cypionate or depot, you'll see in the book it talks about. Anytime you see that word depot, it means that it's going to be given in an IM injection. It has to be given deep, and it's going to last a long time. So that's the whole purpose of that method of giving that medication. Also, there's a topical, transdermal, and sub-Q forms of this. Now, because this is a hormone, we've got to be careful about pregnant folks. You know, messing with the drug, administering the drug, or anything like that. It's not recommended. The metabolism of this medication goes through the first pass method. So if you remember that, oral testosterone extensively is metabolized in the liver. Half of a dose is lost before it even reaches a systemic system. So high doses are needed because of that. And it's excreted in the urine and the feces. So again, it's indicated in an androgen deficiency in men and boys, in hypogonadism. Special population for children must be careful due to early closure of epiphyseal closure. So x-rays must be performed as well as height measured. So again, it can, when given a hormone to an adolescent or to a child, we have to be sure that you know, this doesn't affect their bone growth to the point of you know, adversely affecting that child. So x-rays are going to be done to monitor that. And that's the epiphyseal is a part of the bone that in children it's apart, and then it eventually grows together, and so that's what they use to monitor for adverse effects of this medication for children. Also, premature puberty can occur, and acne can occur. For older men, due to this being a steroid and hormone, we have to monitor retaining of sodium in water, and so that's involving hypertension and cardiovascular adults. For adults, it can also increase prostate and risk of prostate cancer, and excessive sex stimulation and priapism, which is a prolonged erection. Not a good thing. Adverse effects can include acne, a change in the sex drive, hair loss, headache, bitter taste, urination, gum tenderness, hypercalcemia. Okay, so we can see an increase in the calcium there. Jaundice, edema can also be an issue. Masculizing effects are expected to occur as well. A reduction in sperm count can happen as well, and prostate enlargement as well as the priapism. Treatment according to the Mayo Clinic with regards to that priapism is that, you know, and what the problem is, again, a prolonged erection, and it's the result of blood not being able to exit the penis, and it's considered an emergency situation. And I know for a lot of those erectile dysfunction drugs, they have a little thing on their commercials that say, if you have an erection longer than this amount of time, you may need to seek emergency treatment. And so what has to happen with that, if it is a prolonged erection, they may have to actually, and get ready for this, males that are listening, because it sounds really painful, but they have to aspirate blood, excess blood from the penis to relieve pressure there. They can also give medications for it. And if all of that is not successful, then surgery may even have to be done to reroute the blood flow to provide a shunt so the blood can move through the penis normally. Sounds painful, doesn't it? Okay, testosterone is contraindicated with pregnancy, any kind of pre-existing liver issues or disorders with the prostate. And so for nursing implications, we want to look at drug-drug interactions. We want to also monitor anybody with diabetes. If we're dealing with hormones and steroids, we have to always be checking on that blood sugar because we know that those increase the blood sugar. Of course, we want to evaluate for therapeutic effects of this, and basically that would be, the return of the libido in adults. For boys, the sex characteristics are present, and of course we always want to monitor our adverse effects. Teaching is always going to be very important, so take a look at that. It is box 45.3. Now, just a minute about the anabolic steroids. Again, it's a synthetic drug, and it increases the anabolic activity and decreases the androgenic. It is compared with the testosterone, and it was developed to retain tissue building and growth stimulating effects and building the muscle mass. So a lot of times what you'll hear this discussed at is with athletes, and it's meant to help improve their performance, but it is very much against the law and very much against the sports association. We hear about it in the Olympics, we hear about it in professional baseball, basketball, football. And again, it is meant to increase that muscular work capacity, but it does not, it's very dangerous for individuals to use. It is a controlled drug, so it's a Schedule 3, and non-prescription sales are illegal. Adverse effects of the androgens and anabolic steroids can be cardiovascular disorders and liver disorders, CNS problems. On page 835 in your textbook, it talks about how it can damage the body, and it's serious stuff, especially for adolescents. It can stop bone growth. It can damage the heart and the kidneys and the liver, so it can be a real problem for individuals, and we just need to be alert to that as caregivers. Okay, another question. Steroids are legal to use to enhance muscle development and improve athletic performance, and hopefully you're saying no, that's false. They are widely abused in attempt to enhance body development, muscle strength, and athletic performance. Okay, let's move on to our phosphodiesterase type 5 inhibitors. And these are used for the erectile dysfunction. And again, the prototype for this is the sildenafil. And then we have a couple of other drugs that are listed as your exemplars. And notice that they are all the generic name, they all end with fil. So you can use your imagination with how to remember this is used for an erectile dysfunction. With that word at the end of it, fil. So you know it involves the penis, and feel the thrill or whatever. Ever how you want to associate those so you can put it in your memory that these are for erectile dysfunction. It works for me, as long as it works for you. So these drugs do not cause an erection but enhance the erection resulting from sexual stimuli by increasing blood flow to the penis. So the indications for use obviously are going to be someone who has erectile dysfunction. It works by improving the blood flow to the penis, and it is metabolized in the liver by that CYP3A4 enzyme. And there's a lot of other drugs that use that same enzyme for metabolism, so there may be some competing going on for that. It is excreted mainly in the stool. The onset of the medication is around 20 to 60 minutes. And I know you've probably have all seen the commercials out there for the erectile dysfunction medicines, and so you see them in the bathtubs, and it seems like every other commercial is something about erectile dysfunction. And that's just saying it is a nationwide or country or universe-wide issue for males that they experience this. Our adverse effects for this is headache, flushing, dyspepsia, nasal congestion, dizziness, non-arteritic ischemic optic neuropathy. So, I don't know, associate intercourse with problems with hearing and seeing. I don't know. They kind of goes not together, but anyway, it can cause optic neuropathy due to reduced blood flow, and it also can cause hearing loss. With special population, the hepatic problem use needs to use with caution. Also, if a person is on nitrates, that is a no-no. They cannot do those together. That's definitely an issue. And they should take no more than one per day. Teaching for this is in the box 45.6. And of course I have a pictogram for you. So you can see, watch the ED drugs in the ER. So you can see the pulse rate is up, the blood pressure's down, and he's got nitro for chest pain he's taken. So nitrates are contraindicated for any of these drugs. So common side effects it lists are hypotension, priapism, headache, and flushing. Okay, our 5-alpha reductase inhibitors and alpha-1 adrenergics. So both of these drugs, or these drug classes in combination, have helped treat BPH or the benign prostatic hypertrophy, and it's gold standard of treatment. So let's talk a minute about your finasteride. That is a prototype for this medication, and as with the special populations here, older adults, they are prone to hypotension and hypothermic, so we got to do teaching about that and assessment about that, also caution in liver and renal impairment as well. So the indication obviously for this medication is BPH. And our adverse effects, it can affect sexual functioning, such as impotence, also the development of gynecomastia with the breast development. It can cause down sex drive and ejaculation issues, and it can decrease the sperm count. Contraindicated with hypersensitivity with all medicines, of course. Pregnant women should not be crushing the med due to harmful side effects to a male fetus. And it is administered one per day at the same time. And evaluation, we want to hear the patient saying, I'm urinating better. That's going to let us know that this medicine is working. And of course, we're going to assess for those adverse effects. And always do teaching. And the teaching for this is in the box 45.8. Our alpha-1 adrenergic blocker is your tamsulosin. That's your prototype, and it relaxes muscles of the prostate and the bladder neck. Again, its indication for use is your BPH. It is metabolized with use of the liver enzyme and excreted by the kidneys. And the patients need to take 30 minutes after a meal, swallowing the capsule whole. They don't need to open it, chew it, or crush it. Adverse effects: postural hypotension, weakness, sleepiness, insomnia, stuffy nose, sore throat, blurred vision, abnormal ejaculation. And again, we want to teach about all of our medications, and this one is in box 45.8. Our evaluation is that the medicine is working. The patient will report that their urination is working much better. Okay, so we got to think about our nursing process for all of these medications, and be sure to read pages 842 to 843 regarding that. Also remember to consider the patient's self-concept here with all these conditions, because it can be a self-esteem issue, men not feeling like they're fulfilling their role as a male. So, there's lots of things that mentally, they can be going through too, to the point of depression and, again, self-esteem and those kinds of things. So we should take those in consideration when we're caring for patients taking these meds as well. That concludes your podcast.